Where is the rhythm strip here? It's not here. Okay, so the question is somewhere not related to the lead 2, but it's related to the blocks. Any comment? Oh, sorry. This is not a complex. This is a marker of the new lead. So this is beginning of AVF. This is beginning of V3. So this is not a complex.
The beginning of
This is PQRST. PQRST.
What about the beginning of
The first.
There is no problem here with the AV node. Think outside this.
QT?
Hmm? Okay, look at lead. What is the axis here? Axis, yeah.
Right axis.
Right axis deviation. Excellent.
Yeah.
So why did you say right axis deviation?
Because
Positive and negative in one, positive in AVF. We will see it later. Okay. So why did it happen?
because there's LDP.
Normally, anatomically and electrically, left bundle is not only one bundle. It has left anterior fascicle, left posterior fascicle. The left anterior goes toward, left anterior LAF goes away from the LAD artery. This is how I remember, yani. So LAD, it goes like LAD, the left anterior descending artery, it goes towards the apex. So not both the LAD going, the left anterior fascicle, it doesn't go in the same direction of the LAD, it goes in the other direction. Anyway, so this is the left posterior fascicle. Okay. All right. So this is lead 1. ABF. I want 1 ABF. 2, 3 ABF. Okay. So patient has left posterior fascicular block. Let's make it first left anterior fascicular to make it easier. Patient has left anterior fascicular block. What was normally happening that the electrical activity will come to the His bundle, to the right and left at the same time, and the left will be supplied like this and like this at the same time. Yeah? So this patient, when the electrical activity came to the right, it went well. When it came to the left, it got blocked in this direction and then got supplied well in this area. Yeah? Agree? Now, what about this area? It should be supplied. So what will happen? Unopposed activation from the left posterior fascicle to the left anterior fascicle. Okay? Right bundle will tell you guys in both in the left ventricle, you manage yourself. So the left posterior fascicle will go to supply the left anterior fascicle. Who is here? AVL, and who is also the positive is here? Lead 1. Because lead 1 is this part. This is negative, this is positive. So the positive is here. So you will find in the 12 lead ECG that the lead 1 is positive, AVL is positive because it's going up. What about the AVF?
Negative.
And the inferior negative, negative, negative. So if you find that the complex is positive in one and AVL, negative in the others, this is left axis deviation, but it is also left anterior fascicular block. Okay? Left anterior fascicular block. One of the reasons, one of the causes of left axis deviation is left anterior fascicular block. Yeah? As we will see later in the axis determination.
But the
Or-
QRS should be wide, right?
Hmm?
The QRS should be wide.
Not a must. Alright. So, easy? No? Okay.
QRS complex is not wide. How we can say that there is left axis deviation with left anterior fascicular?
Excuse me?
If we are saying that QRS complex is not wide and there is left axis deviation, and how we can say that it's left anterior fascicular?
The ventricle, the complex will be blocked. The complex will be wide if one of the two ventricles is activated before the other. Yeah, we agreed upon this before. Did the two ventricles activated in the same time? Yes, they were activated in the same time. So the complex will be narrow. Okay? We will see the wide later. Your burning mask. Okay. Alright. So, to sum up so far, we said that the electrical activity is coming to the right and left at the same time. Then, when it reached the left, this part was blocked. Electrical activity went downstairs to the left posterior fascicle. But this part needs to be activated. Same idea like right bundle branch block, left bundle branch block. But the right and left bundle branches, they were V1, V6, horizontal. Left anterior and left posterior, vertical. So this is not supplied. So electrical unopposed activation of the left anterior fascicle will occur from down up. From down up, so towards 1 and AVL, so towards is positive. And away from AVF, the AVF will be negative. And 2 and 3 also are inferior. Okay, so can you guess left posterior fascicle? So, and the block is here. What will happen? Electrical activity will come this side, activate this part. So this is unopposed activation downwards. So it will be positive in 2, 3 AVF, negative in 1 AVF. Yeah? Easy? Easy? Alright.
Sir, in general, when you have positive in one and negative in AVF, it's
Exactly.
so when does
One of the causes of left axis deviation is left anterior fascicular block. So if you find that the patient has left axis deviation, so let's search. The patient doesn't have LVH. The patient doesn't have WPW. The patient doesn't have, you exclude the other causes. Not there, so it's left axis deviation. The patient has right axis deviation. So, oh my God, any RVH? No. Any acute pulmonary embolism? No. COPD with pulmonary hypertension? No. No. So it's right, left posterior.
So it's a diagnosis of exclusion.
Exactly. Happy so far? So what is this? Yes. It tells you that there is some small degree of block in the ventricle. That's it. How to treat? Nothing. If you find out that there is no LVH, so no treatment, no WBW, no treatment, blah blah blah. You exclude other causes, it's only left anterior vesicular block or left posterior vesicular block. No need for treatment. Not that significant.